Hi everybody, welcome back. We're going to talk about feet today. We've got Mikkel and Kate again, welcome. And we're going to do a foot series. So projections for a foot series are an OP, an AP, a medial oblique, and a lateral, okay? SID is 40 inches like most of our x-rays. For the AP angle, the tube needs to be angled 10 degrees posteriorly or towards the heel, and I'll show you that in a minute. Central ray is the base of the third metatarsal. Okay. Collimation, lateral, we want to get the skin margins both laterally and medially and anteriorly and posteriorly on the lateral. Okay. We want to include the distal phalanges, and we want to include the calcaneus. So we want to include the entire foot, basically, okay? We're going to shoot these at 60 kVp at like 6.3 mass is going to work just great. If you're unable to angle your tube for the AP picture, it is okay to use an angled sponge to raise the forefoot up to kind of take the angle of the foot off. The reason we do an angle is to open the joint spaces in the foot. You'll notice that the foot is angled down, so we want to match that angle, which is about 10 to 15 degrees. Okay. Okay. Well, let's do this real quick. Okay. Our first picture is going to be an AP, right? You'll note that we've got the tube angled 10 degrees posteriorly towards the heel. Okay. We're trying to match this angle right here. So we've done that. Central ray is going to be at the base of the third metatarsal right here, okay? So we're actually we're right between, what's his name?
Patrick.
Patrick's eyes, okay? That's pretty cool sock. It works out really nice. Okay, so we're going to collimate to the foot, right? We want to see both laterally and medially. We want to include the distal phalange and the calcaneus, okay? And this is a left, so we can go ahead and use our left marker, just like that, okay? We're going to shoot this 60 at 6.3, and it's going to be really, really pretty. Now, the AP is the only picture that you need a angle with. And what I was telling you, some of our rooms are a little bit small, and most of our machines only angle one way. So if you don't have room for the patient to be there and you can't angle your tube, it is okay to use a straight angle and just lift the front of the foot up so it's somewhat even with or parallel with the table, okay? And you can use a perpendicular angle at that point if you don't feel like hanging. And it's going to do the same thing as far as opening the joint spaces, okay? So for the next pictures, we're going to go back to a perpendicular tube angle, and we're going to do a medial oblique. Okay, same collimation. We're just going to take the patient's knee and we're going to roll it in like this. And that foot is going to roll up between 35 and 45 degrees. Okay, we've got the same central ray point, base of the third metacarpal. Again, we want to include the entire foot. Okay, this is our medial oblique. Perfect. We'll use the left marker again, okay? And good collimation is going to make a nice, pretty picture, okay? And then we're going to shoot a lateral. So we're going to have Kate kind of roll over that way, okay? Just like that, okay? Now, I've seen this done both ways. When the ankle and the tib fib are in the same plane, your foot kind of sits at an angle. And a lot of doctors like that because they're able to see the bones a little bit better. And I didn't mean to tickle you. But if your doctor wants a true lateral, you're going to have to lift that foot up a little bit, or lift the leg up a little bit, so it's a true lateral. But for me, I like the little bit angled view, just like that, where the foot's at a little bit of a slope. Okay, we're going to collimate to include the foot again. We've got the calcaneus, we got the phalanges, and we got both dorsal or plantar and dorsal sides. Okay. All right, and that is a foot series, guys. Not much to it. Just make sure you're angling for your AP shot to open up the joint spaces of the foot. And make sure you're collimating well so we can get a good contrasty picture of the bones of the foot. Just be careful when you're positioning these with the patients who are in a lot of pain. Take good care not to twist their foot or anything like that. Use their knee to move their foot if you have to. So question number 1 today is, who is on Kate's socks? Okay, those are pretty nice. So, and how much do we angle for the AP picture? What is our tube angle? Anyway, thanks guys, appreciate you being here. We'll talk to you soon. Bye.